And in so doing, can I call Secretary Sajid Javid to make a statement? Sajid Javid.
Thank you, Mr. Deputy Speaker. I'm honoured to have been asked to become Secretary of State for Health and Social Care. I understand the responsibility that comes with this job, especially at this critical moment. As someone who has sat on these front benches for many years, this past year has been a difficult one. I've been frustrated not to be able to play my part in helping to meet the greatest public health challenge our country has ever faced. So I'm especially proud, Mr. Deputy Speaker, to have been given this opportunity for public service. Nothing embodies the spirit of public service more than our National Health Service and those who work in our social care. I've seen it myself in my own constituency. I saw it again just this morning at St Thomas's Hospital, where I met doctors and nurses and volunteers who have moved mountains this past year. Now they're helping us vaccinate our way out of this pandemic. I pay tribute to them all, and I pledge to do everything I can to deliver for them and the people of this great country. And I look forward to working with colleagues on all sides of the House as we together work on this vital mission. We are making phenomenal progress with our vaccination programme. Vaccination is now open to every adult in the country. 84% of adults have got a jab and 61% of adults have had 2 doses. This progress has allowed us to safely take those first 3 steps out of the lockdown and on towards greater freedoms that we can enjoy today. We owe this strong position not only to the NHS, but everyone that has played their part. I want to take this opportunity also to pay tribute to my predecessor, my honourable friend, the member for West Suffolk, who had worked hard throughout all these testing times. He has achieved a great amount in the work that he did, and I know that he will have more to offer in public life, and I wish him the very best. Mr. Deputy Speaker, there remains a big task ahead of us to restore our freedoms. Freedoms that, save for the greatest of circumstances, no government should ever wish to curtail. So my task is to help return the economic and cultural life that makes this country so great, while of course protecting life and our NHS. Now that task has been made all the more difficult by the Delta variant, which we now know makes up some 95% of new cases in the UK. Not only does it spread more easily, but the evidence points to a higher risk of those who have not been vaccinated needing hospital treatment compared to the previously dominant Alpha variant. This narrowing of the race between the virus and the vaccine led to the government's difficult decision to pause step 4 on our roadmap until 19th of July. We're using this extra time to protect as many people as we can. When the government took that decision on June the 14th, over 4.3 million over 40s had a first dose, but not a second. Now that's down to 3.2 million people over 40. We can all be assured by how many more people are getting the life-saving opportunity that the vaccine offers. So, Mr. Deputy Speaker, at this 2-week review point, I want to update the House on our progress to our roadmap to freedom. Mr. Deputy Speaker, our aim is that around 2/3 of all adults in this country will have had both doses by 19th July. We're bringing forward second doses and bringing forward our target for first doses too, so we can meet that 19th July goal. Vaccine uptake remains sky high. We've seen that age is no barrier for enthusiasm for getting the jab. As of this weekend, more than half of adults under 30 have taken up the chance to be vaccinated, including, in the last couple of weeks, all 3 of my own adult children. And our vaccines are working, including against the Delta variant. The latest modelling from Public Health England shows that they have saved over 27,000 lives and have prevented over 7 million people from getting COVID-19. Now, we do know that after a single dose of vaccine, the effectiveness is lower against the new Delta variant at around a 33% reduction in symptomatic disease. But 2 doses of the vaccine are just as effective against hospital admission with the Delta variant compared to the Alpha variant. The jabs are making a difference in our hospitals too. In January, people over 65 who were vaccinated earlier in our program made up the vast majority of hospital admissions. The latest data shows that that group now makes up less than a third. So while cases now are ticking up, the number of deaths remains mercifully low, and we'll continue to investigate how our vaccines are breaking that link between cases, hospitalizations, and deaths. And I'm also encouraged by new data just today from Oxford University's Mix and Match trial, which shows that a mixed schedule of jabs, such as getting the AstraZeneca jab first and then the Pfizer second, could give our booster vaccination program more flexibility and possibly even some better immune responses. Now finally, Mr. Deputy Speaker, we continue to see a rise in hospitalizations, although in line with the kinds of numbers we had anticipated at this point in our roadmap. The number of people needing hospital treatment for COVID-19 has doubled since the start of May. Admissions are most clearly increasing in the northeast and the southwest of England. So we've been boosting testing centres and vaccines in those areas and keeping a close watch on the numbers. Now, I spent my first day as Health Secretary just yesterday looking at the data and testing it to the limit. Whilst we decided not to bring forward step 4, we see no reason to go beyond the 19th of July. Because, in truth, no date we choose comes with zero risk for COVID. We know we cannot simply eliminate it. We have to learn to live with it. We also know that people and businesses need certainty, so we want every step to be irreversible. And make no mistake, Mr. Deputy Speaker, the restrictions on our freedoms, they must come to an end. We owe it to the British people, who have sacrificed so much to restore their freedoms as quickly as we possibly can, and not to wait a moment longer than we need to. So, Mr. Deputy Speaker, with the numbers heading in the right direction, all while we protect more and more people each day, July the 19th remains our target date. The Prime Minister has called it our terminus date. For me, 19th July is not only the end of the line, but the start of an exciting new journey for our country. So, Mr. Deputy Speaker, at this crucial moment in our fight back against this pandemic, we must keep our resolve and keep on our roadmap to freedom, so that together we can beat this pandemic and we can build back better. It is a task that I am deeply honoured to lead, and one I know will succeed. I commend this statement to the House.
For up to 5 minutes, Jonathan Ashworth.
Thank you, Mr. Deputy Speaker. Can I just say at the outset that despite our fierce political differences, that my dealings with the previous Secretary of State were always courteous, respectful and professional, and I wish him well in resolving his personal difficulties. Now, I welcome the right honourable gentleman to his place and thank him for advance sight of his statement. He will find working with the NHS and social care staff both inspirational and rewarding. And I hope he will agree and make arrangements for them to receive a fair pay rise and not the real terms pay cut that is currently pencilled in. Now, today he has let it be known that July the 19th reopening will effectively go ahead. He told the news this morning that there is no going back, that lifting restrictions will be irreversible. Well, a word to the wise, Mr. Deputy Speaker. I responded to a lot of these statements these last 15 months. I remember ministers telling us there was nothing in the data to suggest June 21st wouldn't go ahead. I remember children returning to school for one day before the January lockdown. I remember it will all be over by Christmas. I remember we'll send it packing in 12 weeks. Well, we've seen around 84,000 cases in the last week, an increase of around 61%. Today, we've seen the highest case rate since January. If these trends continue, we could hit 35,000 to 45,000 cases a day by July 19th. That will mean more long COVID. He didn't mention more long COVID. That will mean more disruption to schooling. For some, it will mean hospitalisation. And we know that even after 2 doses, you can catch and transmit the virus. So what is he going to do to push infections down? Vaccination will do it eventually, Mr Deputy Speaker, but not in the next 4 weeks. Now, I want to see an end to restrictions. Our constituents want to see an end to restrictions. But I hope his confidence today about July 19th does not prove somewhat premature, or even, dare I say it, hubristic. And can he confirm that by irreversible, he is ruling out restrictions this winter? And has he abandoned the plan which the previous Secretary of State and officials were drawing up for restrictions this winter? Increased infections will impact on the ability of the NHS to provide wider care. Today he has promised to give the NHS everything they need to get through the backlog. So will the hospital discharge and support funding be extended beyond this September? Or will trusts have to make cuts instead? And how does he define getting through the backlog? When will the NHS again guarantee that 95% of patients will start treatment within 18 weeks of referral? We know thousands are waiting too long for cancer care. So when will the NHS meet its cancer target that 96% of patients wait no longer than a month from diagnosis to first treatment? When will he give primary care the resources to meet the challenge of the hidden waiting list of over 7 million patient referrals that we would have expected since March 2020? And given the pressures on primary care, is it still his plan to press ahead with the GP data transfer? To be frank, Mr Deputy Speaker, if the department can't keep its CCTV footage secure, how does he expect it to keep our personal data secure? And will we see a plan to fix social care? Or is today's Telegraph correct when it reports that he, the Secretary of State, is of the opinion that we are completely the wrong stage of a parliament to launch a new social care strategy? Is that really his view? And given the pressures across the whole of the healthcare service, will he abandon the ill-thought-through, top-down reorganisation of the NHS that the previous Secretary of State was set to embark on? And finally, Mr Deputy Speaker, given the recent questions of propriety around COVID contracts, he will understandably want to present himself as a new broom. Can he confirm that he will not use a personal email account to carry out government business? Can he explain why the Social Care Minister has been using a personal email account to carry out government business? And why was the Parliamentary Under Secretary of State for Innovation, the Noble Lord Bethel, using his personal email account to discuss the awarding of government contracts? And why did he have meetings with a firm that won a contract but not declare it? Can he tell us whether he maintains confidence in that minister? And isn't it time that that particular health minister was relieved of their ministerial responsibilities as well?
Secretary of State.
Thank you, Mr Deputy Speaker. First of all, can I thank the honourable gentleman for his comments and also what he said about my predecessor. In turning to his questions, first of all, Mr Deputy Speaker, he started off by talking about, rightly so, actually pointing out the incredible work our NHS staff across the country have been doing, not obviously even before this pandemic, but especially, I think we'd all agree, throughout this pandemic. And I heard about that myself this morning with my visit to St Thomas's Hospital, talking to staff there, doctors, nurses, consultants, and hearing directly the challenges they faced at that time, but also the challenges they continue to face. And what I wanted to hear from them is that what more can the government do whether it's on recruitment, its resources, what more help can be provided. So it remains an absolute priority, and of course it is absolutely essential that when the pay settlement process is complete, that is a fair process, and of course it absolutely will be, and it will be a fair pay settlement. Turning to his next question about the move to step 4, the timing of that. Well, I think, Mr. Deputy Speaker, I've set out, I think, quite clearly in my statement the government's plan, the rationale for that plan. But the thing I would point out is that what is at the heart of this is the vaccination program and the excellent work that's being done by many across the country, the volunteers, the doctors and nurses. I visited the vaccination centre today, for example, as well at St Thomas's, the excellent work by my honourable friend here as well. Because the more people that are getting vaccinated, we are seeing clear evidence that we are breaking the link, and this is absolutely crucial. We are breaking the link between people getting infected by COVID-19, so the number of cases, versus those that are actually ending up, sadly, in hospital or even in some cases losing their lives. And the more evidence we see of that, the more confident it can make us that we will put this pandemic behind us. And that is what gives me confidence about the date, July the 19th, and with all the data that I've seen yesterday. I sat down, discussed it with the experts, with my colleagues. It is very clear that we are heading in the right direction, and I am very confident about that date, July the 19th. The right honourable gentleman also asked about the backlog. He's right to raise that, of course, because of the focus, for all the right reasons, of the NHS, the social care system, on dealing with the pandemic. Sadly, there is a significant backlog of cases that has been built up. The government already has provided record amounts of funding to try and deal with some of that backlog. In total, to deal with the pandemic, some £92 billion of extra funding has been put into the NHS and social care system. Much of that is targeted at the backlog, and that is something that will be an absolute priority. It was for my predecessor, and it will be certainly for me, about how quickly we can deal with that once the best and the most efficient way. And just today, with my visit at St Thomas's again, I had some excellent new ideas from the people on the front line, and we will certainly be listening to them as we set out further plans. And then the right honourable gentleman also asked about social care, and I should warn him not to believe everything he reads in the press, and I think he should know that social care remains an absolute priority for this government. For me, the Prime Minister himself has rightly made some very clear commitments on social care, and we absolutely intend to meet them. When it comes to reform, the bill that we've talked about, my predecessor has talked about, this dispatch box on NHS and social care reform. Of course, we're committed to that, and I think that the right honourable gentleman should sit down with me, and perhaps I can persuade him of the virtues of that bill, because I'm sure I can convince him a little bit that it is essential, if he believes like me that what matters most are the patients, the people that are going into our hospital feeling unwell, and that we want them to see quickly and efficiently, we want them to get better, people in our social care system having a better integration, then he'll believe in the virtues of that bill. And I hope eventually he can come to support the bill and do the right thing. And then lastly, he asked me about my ministers. Mr. Deputy Speaker, I've got to say, I have got such a fantastic ministerial team. All of them, every single one of them. That it's not even a question of confidence. It's a group of ministers that are incredibly talented, that have delivered both in this House, in the Lords, and I can say, Mr. Deputy Speaker, I've had some considerable experience of working with ministers, having led 5 departments before, and this is one of the best teams I've ever had.
Chair of the Health Select Committee, Jeremy Hunt.
Mr. Deputy Speaker, my apologies for missing the start of this session, but can I warmly welcome my right honourable friend to his post. He will bring experience, ability and integrity to this role, and I have no doubt he will do it with great distinction. He will understand, of course, that in my role I have to scrutinise him, so I want to say to him now that he is welcome to as many 7-hour sessions of the Select Committee as he is willing to attend, and we look forward to talking to him there. But I do want to wish him well, and I also want to echo his comments about his predecessor. To be Health Secretary in a pandemic is the most difficult job imaginable. And the Right Honourable Member for West Suffolk brought enormous energy and determination to that role, and the country is in his debt. Yeah. As he deals with what we hope are the final stages of this pandemic, can I ask him whether he will also be giving thought as to how to prepare the NHS and care system for future pandemics, and whether at the top of his list will be putting more resilience into the social care system, not just meeting our manifesto promises on a cap on social care, but also making sure that local authorities have the long-term stability in funding to make sure that they really can look after every older person with dignity and respect.
Mr. Deputy Speaker, first of all, can I thank my right honourable friend for his remarks and welcome the scrutiny that he and his committee are going to provide. And I'm not sure about the 7 hours bit, but I very much welcome the scrutiny and the intention. On his two questions, absolutely in terms of preparing for future pandemics, there's a huge amount of work that's already gone on that. Just yesterday, I met the Chief Executive of the UK HSA that will work on much of this. And also, and I think my right honourable friend knows this, but for the benefit of others, the best part of a year I've spent away from the front bench. I've also spent time as a senior fellow at the Harvard Kennedy School, where my project at the time was looking at future potential pandemics, and I'm going to put that knowledge to use as well, and everything I've learned through that process in doing that preparation. But he's also right to raise the importance of the social care reform and the work that needs to be done, including sustainable funding. And he will remember that as ministers, we've worked often together in the past. And again, I look forward to working with him in different roles now, but on the same issue, which is how do we provide a long-lasting, sustainable solution to the social care challenge this country faces. And as I said earlier to the Shadow Health Secretary, this remains a huge priority, and I look forward to talking with my right honourable friend and learning from him too.
Video link. And for up to 2 minutes, Dr. Philippa Whitford.
Thank you very much, Mr. Deputy Speaker. I'd like to welcome the new Secretary of State to his place and thank him for advice sight of his statement and ask how he plans to review or modify current COVID policy. The management of any epidemic is actually not rocket science, but infectious diseases 101, avoiding the importation of dangerous variants through border control and quarantine, and stopping the virus spreading from one person to the next. So does he plan to revise the government's quarantine and traffic light system to avoid importing more variants, which, like the Delta, would threaten the reopening of the domestic economy and society? On Friday, the National Audit Office released a report on the NHS test and trace system, which didn't quite get the media coverage one would have expected. 1 year on, Serco is still only reaching 83% of contacts, while Scotland reaches 98% and Wales 95%. Both of them have used public health and health protection teams from the start. As COVID restrictions are eased, a well-functioning test, trace, isolation and support system will be critical to detect and control small clusters and avoid future surges. So instead of awarding Serco a new contract for over £300 million, should the opportunity not be taken to reform the system? In particular, it's only isolation that stops the onward spread of the virus. But while the £500 isolation payment is welcome, it's less than the minimum wage, and many are excluded by the eligibility criteria. With no results at all registered for almost 600 million lateral flow tests that have been issued, will he shift some of that funding to provide more generous and accessible financial support for those who are asked to isolate? While vaccines are reducing the likelihood of hospitalization, cases are rising exponentially. So does he recognise that just allowing the current surge to go unchecked would put pressure on the NHS and run the risk of even more infectious or vaccine-resistant variants emerging? Thank you.
Thank you, Mr. Deputy Speaker. The Honourable Lady, first of all, she talked about the importance of border control, and of course she's right to do so, and that is exactly why the government has put in place already the so-called traffic light system, working across government with Home Office, with Border Force, and of course this department and Transport and others. And that is a system that absolutely needs to be kept under review, and that's the assurance that I can give her to make sure that it's doing its job and protecting the people of this country from viruses, but especially from any new viruses or any new variants of COVID-19 that may emerge. She's also raised the issue of test and trace, and she should know that the NHS test and trace system is the largest diagnostic exercise of its kind in British history. We've carried out over 200 million tests, identified over 4 million positive cases, and found over 7 million of their contacts. And every one of these, every time this happens, whether it's in England or Scotland or any part in the United Kingdom, this breaks the chain of transmission and it saves lives.
Lucy Allen.
Thank you, Mr. Deputy Speaker. And can I say how delighted I am to see my right honourable friend back on the front bench. I congratulate him on his appointment to this crucial role, and I welcome his approach as set out in his statement today. He will be an excellent Health Secretary. Hear, hear. Can my right honourable friend confirm that 19th July will mark the end of the roadmap out of lockdown, and that terminus means the end of the line, not an interchange, and that it is his intention that all restrictions will be lifted on that date?
Mr. Deputy Speaker, first of all, can I thank my honourable friend for her kind remarks. And as she would have heard through the statement, that it is absolutely our intention to have step 4 commence on 19th of July and remove restrictions and start returning to normal. She's asked me specifically about all restrictions or which restrictions. That is certainly our intention to remove restrictions, but we will, as we follow the data in the coming days, we will set out more in due course.
Nira Wilson.
Thank you very much, Mr. Speaker. Can I begin by welcoming the Secretary of State to his place, and I look forward to engaging constructively with him on a range of issues. The Secretary of State will be aware that during the course of the pandemic, well in excess of 40,000 people lost their lives to COVID in care homes, and the protective ring his predecessor talked about being in place at the start of the pandemic went in far too late. He will also be aware that 2 in 3 unpaid carers, some 7 million people, have reported their mental health worsening as a result of the pandemic, looking after loved ones. So will he help his boss to make good on his promise of almost 2 years ago on social care reforms and honour his manifesto pledge of cross-party work on this issue and meet with me and my right honourable friend, the member for Kingston and Surbiton, to urgently start work on this issue?
Mr. Deputy Speaker, first of all, can I thank the honourable lady for her comments and the nature of her comments about working together, and I think she's absolutely right to say that, especially on something so important as social care. And she's right to raise this as a priority for government, for this House. She reminded the House that sadly that so many people in care homes lost their lives and have done so through this pandemic. She'll be aware that even before the pandemic, the government had pumped billions more into the social care system. During the pandemic, there was a lot of support, but a lot more needs to be done. And I think that's what she's rightly getting to. And the government have said that the best way to find a sustainable solution to the country's social care challenge is for parties to work together and to cooperate together. And I would happily meet with her.
Video link. Alberto Costa.
Thank you, Mr. Deputy Speaker. Can I welcome my right honourable friend back in government, and I look forward to working with him in the months and years ahead. The Fielding Palmer District Hospital in Lutterworth is the only hospital in my constituency. It was threatened with closure, but is now being used as the principal COVID vaccination centre in the southern part of my South Leicestershire constituency. Once the Secretary of State has settled into his important role, would he meet with me to discuss the important future that I hope for this much valued district hospital?
Mr Deputy Speaker, I thank my honourable friend for his question and raising this issue about his local hospital. I absolutely can understand, as a constituency MP myself, the importance of local hospitals, having that support in your local community. This hospital in particular has done a great job with vaccinations and continues to do a fantastic job, and I think that's a very good sign about the contribution this hospital can potentially continue to make the local community, and I would very happily meet with him.
Jim Shannon.
Sir Deputy Speaker, can I thank the Secretary of State for his reply, and also as DUP party health spokesperson in this place and on behalf of my party, can I wish him well for his new role? I have absolutely no doubt that the Secretary of State will do an excellent job. If we are aiming for progression and moving away from restrictions, for instance the wearing of masks, then can I ask when people can attend worship and sit in churches self-distance without wearing a mask, just as diners can sit in a restaurant self-distance without a mask? If we're going to have parity, then I believe that churches should have the same parity as restaurants.
Can I thank the Right Honourable Gentleman for his remarks, and can I say that I agree with him. I agree with him on that point. I think that as we move towards removing restrictions and step 4, we should take into account what he said about churches and the people attending that and the restrictions that they currently face very, very seriously, and that certainly is my intention.
Video link. Dr. Kieran Mullen.
Thank you, Mr. Speaker. Of course, the Secretary of State will rightly be focused on the immediate challenges of COVID, but his department is also about to make decisions related to integrated care systems that have potentially enormous long-term implications for the provision of healthcare for my constituents and the constituents of fellow Cheshire MPs. The NHS wants to create a Cheshire Merseyside ICS, which will not serve the best interests of our residents. Can I ask that the Secretary of State meets with us urgently to discuss this proposal before it's quietly pushed through?
Can I say to my honourable friend that, first of all, can I thank him for the work he's personally done to support the NHS, especially in his work in A&E departments, and thank him and others for that have contributed in that way. Turning to his particular question, no final decisions have been made on ICSs. I absolutely understand the importance of the point that he's made. I want to make sure that we get this right. I would happily meet with my honourable friend. I understand he's already met with ministers in the department, but I would happily meet with him myself as well.
Video link. Barbara Keeley.
Thank you, Mr Deputy Speaker, and I welcome the Secretary of State for Health and Social Care to his new role. During the last 10 years, nearly £8 billion has been lost from budgets for adult social care. And too often during the COVID pandemic, social care has been an afterthought for ministers and officials. The results of this have been all too clear in the tragic levels of mortality in care homes. Now, the social care sector is desperate for investment and reform. So can the new Secretary of State commit today that he will bring forward proposals to invest in and reform social care as soon as possible, and at the latest by Christmas this year, as promised?
Mr Deputy Speaker, where I agree with the Honourable Lady is on the importance of social care, and that it should be a priority in terms of reform, as it is for this government. I don't agree with her characterisation that under this government it hasn't been, she's suggesting it hasn't been a priority. There's been underinvestment. In my own previous roles as local government secretary, certainly as Chancellor, a number of times we've increased funding, but where I think we will agree is that we need a long-term sustainable solution. We are not there yet, and that is something the government is absolutely committed to.
Video link. John Redwood.
I welcome my right honourable friend to his new role. I wish him every success, and I support his plan to unlock soon. Will he look at expediting trials of other drugs and treatments that may help CV19 patients and have been looked at elsewhere? Will he also encourage work on air extraction and cleaning systems to see what more can be done to stop disease transmission, as we're going to have to live with it to some extent?
Mr Deputy Speaker, can I thank my right honourable friend for the welcome, and can I just simply say to his question, yes, I will.
Video link. Clive Betts.
Thank you, Mr Deputy Speaker, and I welcome the Secretary of State to his new role and just say he could begin by launching cross-party working on social care reform by a response to the report done by two select committees, housing committees in local government and health and social care, in 2018. 3 years later, we're still waiting for a government response. Just specifically on test and trace, the NAO report the other day about the national system was hardly complimentary. In his previous role as Secretary of State for HCLG, he will be aware of the great professionalism of directors of public health and the work they do. Yet, in many cases now, as the report from the NAO said, they're still waiting for up-to-date data to deal with local COVID outbreaks. Will the Secretary of State commit to rectifying that situation and ensuring that directors of public health are fully involved in the new model for testing and tracing that will be undertaken from July of this year?
Mr Deputy Speaker, I think the honourable gentleman agrees with me on the importance of social care. We've discussed it in the past as well, and no doubt we will discuss it again going forward. He mentioned the NAO report. If he would allow me, I would take a closer look at that report and I'll write him.
Teresa Villiers.
I warmly congratulate the Secretary of State on his new role. Now that thousands of people are allowed to gather together at a football match and shout and cheer as much as they want, isn't it time that we allowed congregations in church to sing hymns together if they want to?
Secretary of State.
I can tell my right honourable friend that that's certainly what I would like to see. And that is certainly my intention to allow that to happen as soon as possible. And when it does, I hope we can sing a hymn together.
Matt Weston.
Thank you, Mr Deputy Speaker. And I too welcome the Secretary of State back to the front bench. One of the vectors here of the current surge in cases has been the rise in cases in schools. On the 17th of June, we had 250,000 pupils away from school. What steps does he think need to be taken to address the decline in the number of tests being carried out in schools? And does he think that the wearing of masks should become mandatory?
Mr Deputy Speaker, I'm pleased that the honourable gentleman has raised this. It is a very important issue. And it is the point he's rightly, I think, making is that when we are asking children not to be in school for these reasons to try and control infections, that it's having a huge impact, a knock-on impact on their education. And that's something that none of us want to see. Just on this issue, I have already asked for fresh advice from my department, and it's something that I intend to discuss with my right honourable friend, the Education Secretary, to see what more we can do.
Thank you, Mr Deputy Speaker. May I wholeheartedly welcome my right honourable friend to his new position. Given his extensive experience both inside and outside government, does he agree with me that the UK's success post-pandemic will depend on the Department for Health working closely and collaboratively with local councils, social care providers, businesses and community representatives to ensure we protect both lives and livelihoods in the years ahead?
Yeah, I agree wholeheartedly with my honourable friend, and I can certainly say, from someone who's also been the local government secretary and the business secretary, I agree with him even more so, just directly from that experience.
Thank you, Mr Deputy Speaker. The new Health Secretary hasn't been on the front bench for a year, but in that time he's been very busy indeed, lining his own pockets, getting £1,500 per hour for his second job, £1,500 for his third job as well, all whilst NHS staff at Seacroft Hospital and St James's Hospital in my constituency have been working harder than ever, getting our communities through this COVID crisis. Given that the Secretary of State has done very well out of the last year, bagging hundreds of thousands of pounds during a national crisis, wouldn't it be the height of hypocrisy for the new Health Secretary to refuse our NHS staff the pay rise they so clearly deserve?
It's a warm welcome, isn't it?
Secretary of State.
Nice to see you back as well.
The honourable gentleman is going to have to try a lot harder than that.
Video link. Richard Drax.
Thank you, Deputy Speaker. Can I welcome my right honourable friend to his place, like others, and his optimistic and confident statement, which is so refreshing and music to millions of ears. I concur with him when he says we must learn to live with this virus, which will continue to throw up variants in the years ahead. Many constituents are having trouble actually seeing their GPs. Can my right honourable friend help by persuading some in the profession to return to physical meetings?
It's a really important issue my honourable friend has raised, Mr Deputy Speaker, and even before I had this job as a constituency MP, just like him, this is an issue that's come up again and again, and I absolutely understand it, especially from older members, certainly of my constituency, where people have brought this issue up where perhaps they're not as familiar with technology and they want that face-to-face meeting. It is something I have already asked for advice on, and it's something I will write to him if I may.
Video link. Catherine West.
Thank you, Mr Deputy Speaker. Many constituents have contacted me as well regarding GP provision, particularly the letting of key practices to private US healthcare companies. Will the Secretary of State take this opportunity to reassure myself and my constituents that he intends to keep our NHS public?
Well, the right honourable lady will know that the NHS is one of our greatest public services. In fact, it's one of the greatest public services that any country has, and it's an example to the rest of the world. And it's something that we will cherish, we will continue to support in every possible way.
Thank you, Mr Deputy Speaker. And can I warmly welcome your return, my right honourable friend, to the front bench. Some services, such as maternity, were temporarily suspended at Stafford's County Hospital so that their wards could be used to treat COVID-19 patients at the height of the pandemic. But does my right honourable friend agree with me that it is vital that these services are now returned to County Hospital in Stafford as soon as possible?
Hear, hear.
I think, Mr Deputy Speaker, that this is an important issue for many honourable members, where services, in this case maternity services, were understandably, I think it's fair to say, suspended to deal with the pandemic. But as we now return to normal, it is important that these services that local people rely on start returning to normal as well. And if it's helpful to my honourable friend, I can certainly set up a meeting for her with my honourable friend, the Minister, so we can discuss that in more detail.
Marion Fellows.
Mr Deputy Speaker, now that the Health Secretary is in position, will he break from his predecessor's outright refusal to deliver the pay rises to NHS staff in England, which they deserve? Will he, at minimum, commit to matching NHS staff pay rates in Scotland, delivering a pay rise for staff in England, and more money in consequentials to help devolved governments support NHS staff in devolved nations?
Mr Deputy Speaker, I think the whole House would agree that the government must absolutely make sure there's a fair pay settlement for all NHS workers, and that's certainly what there will be.
Liam Fox.
Mr Deputy Speaker, I'm absolutely delighted to see my right honourable friend back in his rightful place on the front bench. There can be no clearer example of a government committed to recycling. I also hope he will bring his customary consistency in approach to the COVID crisis and tell us whether we are actually following dates or data. And in terms of the data we get, it's not just about the number of infections. It's about who is getting infected, what age they are, do they have pre-existing conditions, have they been offered a vaccine but refused to have one. And it's not just about hospitalizations, how many people are there, how long are they being hospitalized for compared to the previous parts of the pandemic, how many of them are requiring extra care, how many are going on to ICU. We need to understand much better how the government are reaching decisions that they do. The British people are not stupid, and Parliament needs to be taken much more into the government's confidence, and I trust, given his previous example of how he's conducted himself, my right honourable friend will do that.
Secretary.
Well, can I first tell my right honourable friend I'm happy to be recycled and that's something we're recycling, something we're all in favour of. But on his very important point about data, and I saw the data in the department for the first time yesterday, in the very detail that it provides, how granular it is, and I have to say to my right honourable friend, I was very impressed with that data. So I can give him the reassurance that the government is looking at the data and absolutely taking that into account. But I also would like to see find a way make sure that we can share as much of that data as possible, so others can benefit from that. And I will certainly be looking at ways to see how we can do just that.
Mr. Deputy Speaker, despite the best efforts of our hard-working NHS staff, COVID-19 has created a backlog of cancer care. Macmillan estimates the current backlog of people receiving their first cancer treatment now stands at 37,000 people across England. One of the key ways the Secretary of State can help with the government's goal of recovering from the pandemic is ensuring we have enough well-trained and motivated NHS staff now and into the future. Therefore, will the Secretary of State commit to addressing the cancer backlog and invest in the NHS workforce to build back better for the future now he's in post? And will he meet with me and Macmillan Cancer Support to discuss this urgent matter?
Secretary of State.
Mr. Deputy Speaker, your cancer diagnosis and treatment has remained a top priority, obviously rightly so, throughout the entire pandemic. 2.47 million urgent referrals have been made, and over 618,000 people have been treated between March 2020 and April 2021. The Honourable Gentleman may also be interested to know that following the Help Us Help You symptom awareness campaign, that many of the sort of so-called missing patients are starting to come forward, and urgent referrals are rising, and that's what we all want to see.
Thank you very much indeed, Mr. Deputy Speaker. Can I warmly welcome my right honourable friend to his post and place on record my thanks to his predecessor, who was always assiduous in attending the Select Committee and indeed the dispatch box. But is my right honourable friend aware that Professor Sir Andrew Pollard, one of the heroes of the Oxford vaccine, recently told my committee that we need to be aware that new variants are likely to infect even the vaccinated. But, and I quote, if high protection against hospitalisation continues, despite the spread of cases in the community, the public health crisis is over. So what will my right honourable friend do to inform the public, and perhaps some officials, that we must move from being concerned about the number of cases of COVID to focusing squarely on hospitalisation?
Mr. Deputy Speaker, I absolutely agree with my right honourable friend. I mean, this is such a crucial point, and it's one that I referred to earlier. That, of course, cases, they're not unimportant, but because now that we have the vaccine, thankfully, and in this country in particular, so many people are getting vaccinated. Of course, we want to see more. We want to see more and more people coming forward, but the take-up is excellent, especially compared to other countries. It is that vaccine that is going to break that link between case numbers and hospitalisation. And as I said, we are absolutely starting to see that, and the indications are very, very positive on this, and I hope that that is the kind of news that my right honourable friend would welcome.
Video link. Paul Blomfield.
Thank you very much, Mr. Deputy Speaker. The Home Office recently updated their visa guidance to say that new international students and those returning to the UK must be here by the 27th of September or lose their post-study work rights. Now, around 1/5 of our international students are from red list countries. Their arrival risks a surge in demand that will overwhelm the hotel quarantine system. Universities UK, the CBI and others have written to ministers urging flexibility on visa rules to enable blended learning to continue and phased entry to the UK. So will the Secretary of State urgently meet with his successor as Home Secretary to seek this change?
Mr. Deputy Speaker, the honourable friend I wasn't aware of this issue. I'm glad he's brought it to my attention, and I certainly will raise it with my right honourable friend, the Home Secretary.
Video link. Jason McCartney.
Thank you, Mr. Deputy Speaker, and I welcome my right honourable friend to his challenging new role. And one of the big challenges in my area is parents, grandparents and guardians having to deal with children and students from local schools and colleges having to isolate for sometimes a third or fourth time in the past couple of months as a result of having been a close contact of a positive case. This is having a huge impact on education, mental health and well-being. So can I ask what extra PCR testing, as well as a new approach to isolating, can be introduced to help support local families and children?
Mr. Deputy Speaker, another very important issue, and he's right to highlight the impact of this isolation that is demanded of children, understandably so, but the impact that it's having in terms of their education, mental health, and in so many other detrimental ways. And that is exactly why I've asked for fresh advice on this. I want to see if there's anything more that we can do, any more flexibilities. I am aware that there is a pilot program in place at the moment that certain local authorities are using, where tests can be used in lieu of isolation, but I want to see if we can go further, and I will be happy to discuss that further with my honourable friend.
Video link. Sir David Evener.
Thank you very much, Mr. Deputy Speaker. Can I congratulate my right honourable friend on his appointment as Secretary of State and wish him well. In Bexley Borough, we have some of the highest performing vaccination teams in the country, and we're all grateful to those involved for their tremendous work. However, will he confirm that the vaccine rollout remains his top priority so that my constituents in Bexleyheath and Crayford can be confident that we defeat this pandemic, ease restrictions and see life return to normality after the 19th of July?
Mr. Deputy Speaker, I can certainly confirm that to my honourable friend. As he just suggests, the vaccine is the best way out of this pandemic. And let me share with him that 4/5 of adults have had their first jab, 3/5 of adults have had both jabs. That's some almost, I think, 77 million jabs across the country, millions more to come. And this is going to be our way out of the crisis. I'm grateful for the huge amount of work that the NHS staff, volunteers are doing in his constituency and throughout the country to achieve this and get more and more people vaccinated.
Video link. Shiomara.
Thank you, Mr. Deputy Speaker. In Newcastle, infection rates are doubling every week, now at over 400 per 100,000. The Secretary of State may think that's not important because thankfully hospitalisation and deaths are not rising at the same pace, but more and more people are being asked to self-isolate. My constituents want to do the right thing, and the vast majority do, but supporters look woeful. Does he recognise that is one reason for higher rates in areas with higher levels of low-paid and insecure work? And as a previous Chancellor, will he fight for more support, including extending eligibility to anyone without access to workplace security?
Mr. Deputy Speaker, I couldn't hear the question entirely, but I think I got the gist of it, that areas that are seeing rising case rates, and as I mentioned, there are some parts of England that are seeing particularly higher increases, that they are being given, I think, as the Honourable Lady knows, that extra levels of support through testing, through tracing, and through other means, including extra financial support, and we will absolutely keep under review how much further support that can be provided to help with the kind of issues that she's mentioned.
Dr. Ben Spencer.
Thank you, Mr. Deputy Speaker. I congratulate my right honourable friend on his appointment and warmly welcome his return to the front bench. Does he share my concerns regarding this winter, when we predict there may be an increase in COVID hospitalisations superimposed on normal NHS winter pressures? And can you confirm that plans and preparations are being put in place now to support our NHS in what may be a very difficult winter indeed?
My honourable friend is right to raise this, Mr. Deputy Speaker. I can absolutely confirm to him that plans are being put in place. A huge amount of work was done by my predecessor. Of course, I will continue that work. Just yesterday, I had meetings on this in terms of winter plans, and I can give him the absolute assurance, not just in terms of vaccinations, but in terms of dealing with the backlog, that there are plans in place, and in due course, I will come to this House and set them out.
Clive Bedford. Mr. Deputy Speaker, the Secretary of State, in answer to my right honourable friend earlier on, said that he was working on a plan for social care, but not there yet, but we are getting there. But can I ask him, the Prime Minister told us that he had a ready-made plan back in July 2019. What's changed? Does that plan exist, or has it been changed? Secretary of State.
The Prime Minister has a plan, and we're working on the detail of that plan.
Video link. Hugh Merriman.
Thank you, Mr. Deputy Speaker. And can I also welcome and congratulate the Secretary of State to his position? Can I ask if his optimism on the end of domestic restrictions extend to those who want to go abroad to take up international travel again or work in the industry? Can I also ask him if he's confident that the 3/5 he mentioned that have been double jabbed will be able to go to amber list countries without quarantine? And would he be willing to meet with me and other colleagues who share a similar concern that we need to do more to try and help our industry?
Mr. Deputy Speaker, my honourable friend will know, first of all, that July the 19th, the restrictions that were removed were focused on domestic restrictions. He knows that separately we also take very seriously the sort of border controls and the border restrictions and the so-called traffic line system. In terms of making any further decision on that, he'll know it's kept under constant review and on a very regular basis, and it's something that I intend to sit down and discuss with my right honourable friend, the Transport Secretary, as soon as I can.
Harper. Thank you very much, Mr. Deputy Speaker. Can I first of all say I very much welcome my right honourable friend's return to the front bench. I know from my experience of dealing with him in government that he's a man of real integrity, and that's an essential quality in a health secretary at a time like this. So I welcome his appointment. I welcome his tone and his intent to get us back to normal. But let me just pick up an earlier answer to our honourable friend, the member for Runnymede and Weybridge. There are those in government, from documents I have seen, who are preparing the ground for the return of restrictions in the autumn and the winter. Can I ask my right honourable friend to rule out the use of lockdowns and restrictions in the winter as a mechanism for managing COVID, and look at alternatives to make sure the NHS is able to deal with us getting back to normal?
Mr. Deputy Speaker, first of all, can I thank my right honourable friend for his kind and warm remarks, and I know he's taken a great interest in throughout the pandemic on the restrictions in particular, and I absolutely understand why it's been so important to him and to others. So one thing I'd like to say to him already, I'm very happy to meet with him and discuss these issues in more detail and listen to his views. And when it comes to restrictions, he should know that it's my intention, it's the government's intention, as I've said, I think from day one on this job, is to remove all restrictions as quickly as possible.
Final question, Steve Bryan.
Warm welcome to my honourable friend. I wish him very well. I'm looking for a change in policy as much as a change in tone. So can I just return him finally to the subject of education? Estimates suggest 250,000 children are missing school today due to precautionary isolations. The vast majority of them sequential due to the bubbles they're caught in. 10 days of isolation is then unavoidable under the current rules, even with a negative PCR test. Haven't our young people suffered enough? Are we really going to continue to do this to ourselves? So is this not an area, Mr. Deputy Speaker, given the availability and reliability of testing now, where I might find that change of policy I'm looking for?
Secretary of State. Again, as other honourable members have rightly raised this, my honourable friend is right to draw attention to this once again. This is a very important issue, and it's something I've focused on day one on the job. That is why I've asked for fresh advice on this. As he knows, this decision was made with the data that was available at the time. Clearly, data is changing all the time, and we must make sure that we keep that under review for exactly the right reasons that he's just set out. And as I say, I have asked for advice on this, and I will be hopefully be able to say more on this as soon as possible.
I'd like to thank the Secretary of State for Health for his statement today, and in his first outing in the new role has responded to 31 questions in 1 hour. So thank you very much. Point of order, Kay Green.
Thank you, Mr. Deputy Speaker. Last Monday, following education questions, I raised a point of order querying the Secretary of State's claim that the government aimed to roll out tutoring to 6 million pupils. The Secretary of State insisted that that figure was correct. However, at the end of last week, Schools Week reported that when they approached Department for Education officials about the figure, they contradicted the Secretary of State, saying the pledge is for 6 million courses, not 6 million pupils. Mr. Deputy Speaker, in light of this discrepancy and the possibility that the Secretary of State has given incorrect information to the House, can you advise me on what steps I can take to ensure that he comes to this chamber to clarify the matter in order that honourable members can be sure that we have accurate information?
I thank the honourable member for giving notice of this point of order, because it does allow for fuller responses, which I think is what every member would like. So although the content of answers to parliamentary questions and contributions is not a matter for the chair, I must remind the House that the government's own ministerial code requires ministers to correct any inadvertent errors in answers to parliamentary questions at the earliest opportunity. If an error has been made in this instance, I'm sure that the government will seek to correct it as quickly as possible, and I know that the whip on duty will pass this on to the Minister, and if the honourable member wishes to pursue this issue, I'm sure that the Table Office will be able to further advise her. We will now suspend for 3 minutes. Order.